welcome to our Monday Minute. We're here today to discuss the VBID demonstration, the value-based insurance design model, which has included a Hospice Carve-In since 2021. The VBID demonstration regarding the Hospice Carve-In specifically has made an announcement that carve-in will end December 31st of 2024. Be careful to understand that you may see information regarding the VBID model continuing with Medicare Advantage, and that is true with the exception of the Hospice Carve-In. The Hospice Carve-In began in 2021. We had been told in 2023 that it would be extended to 2030, and it has now been a shocking announcement released that it will end December 31st of 2024. CMS has not given us any specific details at this point as to how hospices will handle the transition from the end of 24 into 2025. Many have assumed at this point that any patient enrolled in a VBID model Advantage plan would simply roll over to traditional Medicare services as of January 1st, but we do not have anything in writing to support that thought at this point. CMS did say in the announcement that they will ensure hospices are fully paid for the care they provide through December 31st of 2024. There are 2 years of reports that have been released regarding the VBID demonstration and the Hospice Carve-In. It would be very informative for you to read those reports. There are definitely issues that have come to the forefront during this demonstration from both the hospice side as well as the Medicare Advantage organization side, and some interesting read. One of the biggest happenings that we think led to the ending of hospice involvement in VBID was United Healthcare pulling out 24 of their Medicare Advantage benefit plans that had been participating in the model, completely removed effective January 1st of 2024. That caused the number of participating benefit packages to fall from 119 to less than 85. It was quite shocking to see that take place as well. I think it has been much more of a struggle for the Medicare Advantage benefit plans to adhere to hospice requirements, being able to process claims effectively, accept notice of elections. We could go on and on. But there's also been issues on the hospice side with getting paid, with getting the organizations to understand how hospice payments even work in some cases. And there was even some pressure put on hospices by the Medicare Advantage organizations to basically go out and recruit patients. Very, very concerning. While this is going to end on December 31st of 2024, please understand that no one believes that this will be the end of hospice involvement with Medicare Advantage. There will be a temporary pause, yes, but we fully believe that they will be immediately reviewing and absorbing all of the issues, all of the benefits that came from the VBID demonstration with the Hospice Carve-In, and will eventually come back to the place where hospice will again need to have developed relationships with Medicare Advantage plans, because we feel strongly that hospice will be a part of the Medicare Advantage benefit packages at some point, probably in the much nearer future than any of us would like. We do want to emphasize that this is only March of 2024, and there are 9 months left in this year where if you admit a patient that is currently enrolled in one of the participating plans, you will have to fully comply with the VBID regulations in order to receive payment for your patient. Out-of-network providers should be paid the full traditional Medicare rates. However, you may be subject to additional medical review of your charts, etc., before they make those payments. In-network providers obviously have contracted with those VBID plans and will be paid the rates that were negotiated. Keeping in mind, if you have not yet experienced this situation, that if you were to have a patient between now and December that was enrolled in a VBID participating plan, you would need to ensure that you are billing both the Medicare Advantage organization and your Medicare MAC, Palmetto GBA, NGS, or CGS. We want to thank you all for participating today. If you have any specific questions or need assistance with the VBID Hospice Carve-In in any way, please don't hesitate to let us know. Thank you and have a fabulous week.